Hey guys, welcome back to my channel. If you haven't been here before, my name is Abby and I'm a nursing student who moved from Los Angeles, California to Chicago to go to nursing school. So since I last posted, I've been doing a lot of fun stuff. I went and saw Billie Eilish, which was super fun. We got to see the river get dyed green for St. Patrick's Day. It was a whole lot of fun. My sister came and she really enjoyed it. I've also been eating all sorts of food, which is just mandatory in Chicago, to be honest. But of course, I've been doing a lot of studying. I got 2 parking tickets, which sucks, but it's been part of the journey. I've been making so many Quizlets, I cannot explain. But yeah, school's been tough. It's been real tough. But somehow, I am still alive. And so for today, I thought I would share with you guys a day in my life at Clinicals. So to give you guys kind of an accurate description of what I do, I thought I would start with the night before. So for us, Clinical starts at 7 a.m. and you don't always have control over where they send you. So for me, that means I have a 45-minute drive on top of waking up super early. So I start the night pretty early. I try and start getting ready for bed around 9 so I can be like in bed and falling asleep around 10:30. I go to bed and then I wake up super early. I wake up a little bit earlier than you would really have to, but I do like to wake up and like have time to gather myself, watch TV and do something positive that like puts me in a good mood. So here I'm just washing my face. I try to just feel fresh and clean. I look so swollen. Or maybe that's just how my face looks. I don't know. Yeah, I get everything prepared. So I have some water and then I get dressed. So we just wear scrubs when we're in the hospital, which most people do when they have clinicals. So I get those out. I always just have them ready to go. And then I go ahead and get my socks. These are the ones by Clove. Clove sponsor me. And then I also have my badge. So then I go ahead and do my hair. Right now it's straightened. So at Clinicals, they just require that your hair is, up and out of the way. So I just clip it back. I mean, I literally only have 2 hairstyles I do with this. So pretty easy. Then here I am all dressed, ready to go. Of course, watching Modern Family so I can get a serotonin boost. Then I go ahead and, prep my breakfast and I get my shoes on. These are also by Clove. These are super easy to slide on and they're like water resistant or fluid resistant. So you can wipe off anything, that you might get on your shoes, which is a bonus, especially when, bringing in hospital shoes into your home. Then I kind of just like take a minute to like relax and enjoy the show and just feel like my life isn't crazy every single day and that I'm tired. And I just love all my cats because I always feel bad leaving them. And then I gotta turn it all off and head out the door. So the drive is pretty clear cut, nothing special about it. The only thing I really do when I'm driving is kind of thinking about what I want to do when I'm there. So kind of just setting a goal. This is not necessary, but I've found that it's actually quite nice to have a goal for that clinical rotation or that, that clinical day. Just kind of thinking about what's something I haven't gotten to do. Is there a skill that I really want to practice? Any, worries or concerns? Anything like that is kind of what I think about. And then, of course, just listen to music, podcasts, and then drive my way there. So once I get here, I put on the rest of my, stuff. I don't know why the word didn't come to me there. Okay, so I live by these things for your ears because my ears are so sensitive to the pressure that I literally could not make it through clinicals if I didn't wear this. So once I get here, I try to get here They give report at 7, so I try to be in there before that so that I can put my stuff away and, you know, say hi to my instructor and everybody else. So what I take out with me is my clipboard, which folds in half so it fits in my pocket, which is a win. I also have to bring my stethoscope, which most people wear around their neck, but honestly, it kind of hurts my neck, like after a while, so I just put it in my pocket, and then I just whip her out when I need it. And then I bring pen, recommend one that just, you know, you press down and has multiple colors, because you don't want to deal with the cap of the pen. I've done that. And then it's just nice if you need to write important things in different colors. I have so many alcohol wipes already in my bag that I leave in my pocket, so I take some of those because you will need those throughout the day. And then I grab my scissors and then my pen light. I don't always use everything, but you never know. It's always nice if you're the person you're kind of shadowing for the day needs something and you have it. Good little points to have. I gotta put my coat on and then we're gonna go inside. It's like 6:40 now, so we're doing good. So filming in the hospital is really difficult. I have to adhere to HIPAA and I have plenty of things to do, so I couldn't really capture too much of what I do and what everything looks like. But here's just the nurses lounge, you know, the staff lounge, and this is just a little area in the emergency department that I was placed in for that day. Super cool. And then I also threw in a quick little detour. Since I can't show you guys too much of the hospital, I thought I'd show you the outpatient behavioral health clinical I had a week ago at the Orland Township. This was super cool. We went out and visited the things that they offer everybody in the community, from their food pantry to the tax auditor to their driving services, their elder, you know, bingo night. It was really cool. I had no idea that this kind of thing existed. They even have like an Easter drive, which is super cute. So if you live in this area and you know anyone or you yourself could benefit, please visit their website. All right, folks. So this angle really is just not for me. But anyway, I finished my clinical day. It is around 12 o'clock. Usually, okay, actually, I cannot even say usually. It really depends on your site and your instructor and what you have to do. Usually, you get a lunch and you have post-conference. But our hospital for med-surg doesn't allow us to do post-conference, so we usually get out early and kind of do like a outside post-conference. It was a great day. So today is my med-surg clinical, but I was actually placed in the emergency department, which is one of my favorite places to go. It was very relaxed, like nothing really crazy happened, but I got to do some medication passes, you know, spiking some IV bags, putting in some medications, which is something I had the goal of trying to do more of because I haven't really gotten to do that. I think my next goals would be more IV meds, maybe we're actually going to practice putting in IVs, but I need to just do some homework on like different gauge sizes, needles, and all that kind of stuff, just because I don't really know it that well. So I would like to work on that. Overall, it was great though. It was good. All the nurses were amazing. I was paired with a nurse who was also orienting a nurse to the floor or to the unit. So it was kind of nice. I got to learn, you know, how their system works just because she's teaching somebody new. So great opportunity, and the nurses were great with allowing me to do their job when I could, you know, when it's applicable. Yeah, and good patient interactions, very interesting ones as well, hearing other things. It's currently raining, so I hope I'm able to be heard. Anyway, I'm on my way home. I'll probably put in or like show you guys the little bar which is a medication administration record. So this MART is for a patient that I got to initiate a lot of the IV medications. So we started the IV line, and this particular patient is in for alcohol withdrawal, so which was perfect because it's lining up with a lot of the stuff I'm learning. So they did a CWA on him, which is basically a scale that's kind of looking at alcohol withdrawal and how extreme it is, and what the nurse and the doctor, the whole team, everyone needs to be looking out for. So this here is an example MAR that will kind of exemplify the type of patient I was seeing in the emergency department. So every patient in the hospital has this. This is what nurses look at to know what medications a doctor has or a prescriber has asked for that patient. So here we have the medication name, the dose, the route, infusion rate, and the time at which the nurse needs to administer the medication. So if this is interesting to anyone, I'll just do a quick little, view at what each medication is and kind of why we were giving it. So this was for that patient I was talking about with alcohol withdrawal. So what was prescribed was lorazepam or Ativan. It is an anti-anxiety drug and an anti-seizure drug. So as I was discussing, we are, of course, in caution of possible seizures and the anxiety and shakiness that comes with alcohol withdrawal. So I believe that's the reason it was prescribed for the patient. Then we also had thiamine, which is used to supplement the thiamine that a lot of chronic alcoholics tend to lack. And this is because when you drink a lot of alcohol consistently, your GI tract becomes super inflamed and it has a very difficult time absorbing nutrients. So oftentimes these patients will be thiamine deficient. So the doctor will order thiamine drip, and this is to avoid something called Wernicke. I think it's called Wernicke's-Korsakoff syndrome. I don't even know if I'm saying that right. It could be Wernicke. I don't know. But if you want to look into it furthermore, please do, because I'm not super well versed in it. But my understanding is it is linked to a thiamine deficiency that causes something similar to dementia in terms of retrograde amnesia. And then lastly, we have a banana bag, which just has a whole lot of stuff in there. You can kind of see it has thiamine, folic acid, all these electrolytes that are lost with alcohol use, and of course replacing fluids since they tend to be low on that. So that's just kind of a background on what the drugs are and kind of what they're focused on treating in this particular case. It was super cool. I got to spike the bags, give the Ativan, pull it and scrub the hub, all that kind of stuff that they teach you. It's always funny because you hopefully get the opportunity to try it at least once in lab, but everyone's kind of giving you instructions. You're kind of like, what's going on? I don't know how this IV machine works. It's beeping at me. I don't understand. And of course, every facility is different, so sometimes you get used to one machine or whatever it be, and then it's a little bit different. So it was nice to get the hands-on experience and have a patient nurse do it with. So, yeah. But anyway, I'm going to go home now, and I have plenty of work to do today. Plenty. So on this day, I was able to get out pretty early. Other days when I have behavioral health inpatient, we tended to go all the way till 2:30 sometimes when we would have a long post conference. But I always come home very gladly, ready to see my cats and ready to take a nap. So yeah, I hope this just gives you guys a little idea of what happens at clinicals. So thanks so much for watching. Don't forget to follow and subscribe, and yeah, I'll see you in the next one.